I'm Ramesh Menon, Director of Genomic Medicine and Personal Genomics at MedGenome Labs, Bangalore. So, on the World Diabetes Day, as you know, the disease diabetes is one of the most growing disease, exponentially growing disease in the country, and if you look at the numbers, it is like from if you look at the last 25 years now. So the disease has grown almost three times, in the last 25 years. But if you look at the population increase, it is like 1.5 times. So the disease is growing. Is the of course the factor of better diagnosis there still the growth rate is very high, especially if you compare with the other global population. The incidence of diseases such as diabetes is much early, almost a decade early or more in a country like in India. Now there are programs like especially the nationwide program NP-CDCS, to prevent diseases such as diabetes, stroke, cancer, cardiovascular disease, etc. So the nationwide program started in 2010, and it is across it's a nationwide program. So one of the valuable component in this program can be a genetic screening. So coming back to the diabetes case study. So if you look at from a genetic perspective, it can be divided into two. One is like a early onset diabetes, which which can arise from genetic mutation in one or few genes. Examples of early onset are type 1 diabetes, or rare forms such as MODY or neonatal diabetes, etc. But the majority of the diabetes that we see is like is a relatively older onset, like type 2 diabetes. So so type 2 diabetes can unlike the early onset one, which arise from the monogenic mutations. So this late onset or the comparatively later onset type 2 diabetes can arise from it's a multifactorial. Basically, coming to the genetic part of it, it's polygenic in nature. That means it's not one or a few genes or few mutations. It can arise from hundreds or thousands or millions of genetic markers. So of course, it's a multifactorial. So not only the genetic factor, but also the lifestyle, environment, other factors also contribute in the onset when the diabetes will develop. But the underlying genetic factor can be screened now at very early age, like newborn screening, or such thing can much early to the clinical diagnostic. That means when the numbers, biochemical parameters or the numbers derange, so much before that one can know their risk of developing diabetes and other diseases much early in life. So it could be one of the very valuable component to the NPCDCS program, nationwide program, to have the genetic screening also included as one of the parameter in the program. So that's all about on the World Diabetes Day. Thank you.